I welcome everyone for today's webinar, which is called Dietary Food Nutrition Services Meeting the CMS Hospital and CAH, COPs, DNV Healthcare. I would like to now present our presenter for today. Her name is Laura A. Dixon. She is my favorite speaker now. So I would like to now hand over the floor back to our speaker. Over to you, Ms. Dixon.
All right. Well, thank you very much for that very nice introduction, and welcome everyone to this program. As David mentioned, it talks about the dietary standards for CMS and Joint Commission, and that's really what hospitals need to know. Now, you probably think, why are we talking dietary? Because dietary does have such an impact on the overall condition of a patient and also the operations that go on. And so that's why CMS really dedicates an entire section to dietary regulations. Let's talk about the conditions of participation for dietary and nutrition services. Conditions of participation are just that if you have a hospital and you're a member of a hospital and you want to participate in receiving Medicare and Medicaid benefits for patient care, then you have to comply with the conditions of participation. And they have a separate manual that encompasses all types of facilities. Each type of facility has a separate appendix. For hospitals, it is Appendix A. For critical access hospitals, it's Appendix W. Now, the thing is with CMS is you have to follow all of these regulations no matter the patient or their payer. So it doesn't just apply to Medicare or Medicaid patients. It's all patients, your private pay, your indigent patients. The idea behind doing these programs is so that you as a hospital don't get one of these, that if the CMS surveyor comes out, they don't issue a statement of deficiencies, which are those that you did not meet according to those conditions, and that you have to provide them with a plan of action and plan of correction. The regulations all have, or most of them have, interpretive guidelines, and they are in the State Operations Manual. I'm going to show you what that looks like here shortly. And they're found on the website. I always include the website in all of my programs so you can go right to them. You can look up the tag number in that manual as it relates to any particular one. Food service starts at A618 for the hospitals. They are now being updated, by the way, those manuals. They are being updated almost annually. This year, that occurred in February of 2020. We have not had any updates yet. And with COVID, I have a feeling we may be a while before we see any more. But you want to make sure that you're checking not only to make sure you have the most current manual, but also any certifications and survey transmittals that come along. It all starts in the publication for the Federal Register. That's where all of these rules and regulations start. Step 2, CMS comes along after they've issued their regulation, and they put out their interpretive guidelines, which is essentially that. It is what's going on and what do you have to do to meet that requirement from CMS. There's a lot more information, by the way, in those interpretive guidelines that what you have to meet than what's in the actual regulation. So it's very important to make sure you read those interpretive guidelines. Some will include a survey procedure, and that's exactly what it is. That tells the surveyor what they are specifically to look at. Now, that's not all-encompassing because they will look at a whole lot more, but really that is what a good indication to you on what they're going to look at. For example, there'll be questions of ask patients to tell you if the hospital told them about their rights, or look at this many records to see if they're in compliance with CMS. This is the State Operation Manual Overall Index. You will see on here that it shows Hospital A and AA. This was updated, and now psychiatric hospitals have been melded into Appendix A. There is no longer an Appendix AA. Once you click on that, this is what it will look like. This is Appendix A for hospitals. That's usually your over 25 beds and more. Your pay for service, for example. And it also has a link to where you can hit on the transmittals. I'm going to talk about those in a little bit too. And this is for your critical access hospitals, your 25 beds or less. Those are specifically certified as critical access hospitals. They are separate manuals. The email and the links, the emails I gave you on the second slide, here are the internet links to go access those. Again, you will see this was updated in February of this year. These are the survey memos that I had mentioned also. I put the internet link for it. This will keep you up to date on what the changes are. It's kind of a heads up to you that, by the way, we've made this change. and you'll hit that link. And then once you want to find out the most recent one that comes through, because these vary, you want to triple click the posting date. And triple click because it starts at that one, then it goes backwards for some reason to like 2007, and then it brings you to the most current one. You'll see a lot of these have to do with COVID. These are all the changes that have been coming up. One of the most recent ones that affected hospitals, laboratories, and long-term also had to do with COVID reporting. That came out in November, early November, and it was very extensive on what had to be done and what had to be reported. So let's talk about deficiency reports. And really, deficiency reports are just that. When a surveyor comes back from a survey, they will upload the information on all of the deficiencies they found by tag number. And so it's available to anyone. And CMS felt this was so important for everyone to have information on, hey, by the way, this is what we're finding. Now, it does give you the name, address of the facility they went to and the date of the survey, but it also includes the tag number. It's really helpful information because it helps you focus on what are the hot topics that CMS is finding now. If you're going to look to start to do, say, a gap analysis, it's a good place to start. Not only are worksheets are available that you can use as a gap analysis tool, but also look at those tag numbers. What are they honing in on, and where have been the problem areas before? So again, I mentioned the list includes a hospital name and address, and the tag numbers that found to be out of compliance. You will see when you look at that, there are multiple ones on patient rights. That includes restraint and seclusion, grievances. There's also a large section on EMTALA violations, consent, advanced directives. And there are two other websites. These are by private entities, and they publish information on nursing homes. So if you have a nursing home or a long-term care facility associated with your hospital, it's another access point for you to find out what they are looking at. This is what it looks like when you hit on the link for the deficiency data. You'll scroll to the bottom of that page. There are two Excel documents. One are for facilities, hospitals. The other is for your dialysis centers. Go to the hospital one. By the way, it's a very long Excel document, but you can filter and sort according to tag number or even location, if that's how you wish to do it. And then it will bring you up all the deficiencies. As of last week, late last week, these were the deficiencies for dietary alone. These are cumulative, by the way. So they start back in 2011, sometimes 2007, and will go forward. And these are all the tag numbers. We're going to cover most of these, by the way, during today's program on what's required. But you'll see they're pretty well spread out evenly with the exception of the Director for Dietary Services. There aren't that many in dietary. Now you think, well, that's still 320, but nursing is 6,000. And so this is a fairly low number, but nonetheless, they are finding deficiencies. I mentioned that there were some resources that by private. This is another one that you can access. And this is by paragraph form, where you can search for hospital inspections and what the deficiencies were noted. So why were hospitals cited for dietary issues? One, they didn't have all the required policies. CMS is very, very interested in policy and procedures. I can't think of one tag number or one section in the whole manual where there is not a reference to a necessary policy and procedure. They want hospitals to be organized and be able to process and perform according to very established standards. And that means sometimes policy and procedures. Hospital did not get a consult from the registered dietitian as required according to their policy. And so not only do you have to have these policies, you have to abide by them, which can also be a double-edged sword. CMS says you have to have these policy and procedures and abide by them. Thank you very much, and stay safe, everyone.